Stephanie Belflint joins us now to talk about minimally invasive valve surgery. Now, if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. And joining us is Dr. Harris. Thank you so much for joining us. And you're where? Where are you located?
I'm at Baptist.
Oh, at Baptist. Okay.
Yeah.
Now, what is minimally invasive valve surgery?
Well, we're talking about heart valves. We're talking about operating on them. And the traditional way of doing that surgery is making an incision over the length of the breastbone. But in minimally invasive surgery, we make small incisions, somewhere around 4 centimeters in length, 4 inches or so.
And so that takes if nothing else, recovery, right?
Yeah, you tend to have maybe less pain. Pain is subjective, but in general, patients tend to recover quicker. They tend to have better lung function and mechanics afterwards because maybe they don't hurt as much. Of course, there's a cosmetic element to it too. A lot of the incisions are a little easily hidden, and people are happy with that.
Now, what situation would cause you to have the valve replacement?
Depends. When you're talking about the aortic valve, many people have what's called aortic stenosis, which is narrowing of the valve. Some people have leakage of that valve. When we talk about the mitral valve, which is between the collecting chamber and the pumping chamber on the left, some of those are stenotic or narrowed, but many of them leak. And in that case, most of those are repaired and not replaced on the leaking valve.
And what age group are we talking here?
I've done valve surgery and done minimally invasive valve surgery on people from as young as about 19 to, I think the oldest is 94 years old.
Oh.
So everybody's a candidate for it.
So
Amazing.
Something you're born with?
The valve problem?
Yeah.
Some people are, and some people acquire them as they age.
Just with eating bad and not exercise?
Some of that can happen. Some of it is maybe has a genetic component to it. Some of it is just maybe just kind of bad luck.
What are some of the symptoms when the person comes to see you? They know, okay, I've got a problem here. I need to go see Dr. William Harris about, this valve problem.
Well, many people have their doctor picks up a murmur, where they've got a murmur, and then that leads to investigation with what's called an echocardiogram, which is a little sonogram on the chest that allows us to look at the heart valves and see if there's a structural problem with them. Some people actually have symptoms. They either get chest pain, or they get shortness of breath, or easy fatigability, and it becomes difficult for them to carry out daily activities.
Dr. Harris, the field of cardiology is evolving at such a pace that I'm not sure who's a surgeon anymore and who's a cardiologist, because cardiologists do casts, but do cardiologists do minimally invasive, or is that a surgeon who would do that?
Yeah, I'm a surgeon, so surgeons would generally do those types of procedures, and the cardiologists tend to do the diagnostic procedures, as well as some therapeutic things like heart stents and things of that nature.
And balloons, I mean, don't they do that?
Yes.
How dangerous is a valve if you have a problem with your valve? Could this be deadly?
If it's untreated, yes. People with aortic valve stenosis that have symptoms and are not treated have about a 50% 2-year survival.
Wow.
Yeah, so it's nothing to sneeze at.
Of course, I guess that's the major valve, but can you have it in just any
Yes.
valve in there?
Yeah, there are 4 heart valves, and we operate on all of them, 3 of them more commonly, and it's not an unusual event to operate on a couple of valves, even 3 valves at a time.
Now, if this happens in a young person, does exercise, make it worse?
It can. It sort of depends on the valve pathology and whether they've got a leak. And usually a young person is going to have a leaking valve. And when they exercise, it tends to, if it raises your blood pressure particularly, it sort of aggravates the leaking and causes back pressure into the lung arteries, and then that gives them shortness of breath.
Wow. I'm amazed. When you said 19 years old, I have a 19-year-old. That's amazing to me.
It's frightening is what it is.
It is.
Well, the good news is we can take care of these problems in a very safe, effective way. And the nice thing about minimally invasive surgery is we don't compromise the operation that we do. It's the same repair or replacement that people can have with a more open, traditional type procedure, but it causes less trauma and leads to, I think, quicker recoveries.
Oh, I bet. Dr. William Harris with Baptist Medical Center, thank you so much for joining us and giving us some insight on that. And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.